friends, today our topic of discussion is on the caloric testing. See, what is caloric testing? The word caloric means related to heat, and caloric testing is also known as the caloric stimulation test, is the oldest method for the functional assessment of vestibular system. Okay, and is a test that uses differences in the temperature to diagnose the damage to the acoustic nerve. Now, what is acoustic nerve? Acoustic nerve is the vestibulocochlear nerve that consists of vestibular and the cochlear nerve, and is the eighth cranial nerve, also known as the auditory nerve. Okay, so this vestibular cochlear nerve is involved in the hearing and balance. See, the vestibular nerve is primarily responsible for maintaining the body balance and the eye movement, while the cochlear nerve is responsible for hearing. Let's see, what is it? Description. So, caloric testing provides information about the function of the vestibular portion of the eighth cranial nerve and aids in the diagnosis of the cerebellum and the brainstem lesions. Okay, so the test also checks for the damage to the brainstem also. Next, let's discuss its procedure. How to do this? See, the patency of the external auditory canal is confirmed. The client is positioned supine with the head of the bed elevated 30 degrees. So the cold or warm water is instilled into the auditory canal to stimulate the semicircular canals. Okay. Canals, the normal response that indicate the intact function of the cranial nerve, third, sixth, and the eighth is conjugate eye movement towards the side being irrigated, followed by the rapid nystagmus to the opposite side. So what is the rule? See, a rule of thumb is the warm air or a water will produce nystagmus that beats towards the test ear, and the cool air or a water will produce nystagmus that beats away from the test ear. Okay, so absent or a dysconjugate eye movement indicate the brainstem damage. So this is all about today's topic. Hope this small video is clear to you all. Thank you.